Hello, this is Dr. Brett Taylor. Today's case we're going to discuss an individual who presents 2 years after a neck injury. I determined based on a reasonable degree of medical certainty that his work accident resulted in a permanent aggravation of his neck condition and it required further treatment. He had a prior fusion C5 to C7 and he presented with persistent neck pain with positive findings on physical exam for myelopathy. We diagnosed him with cervical myeloradiculopathy. His imaging studies revealed a positive or solid fusion at the previous operative levels C5 to 7. And there was evidence of adjacent segment disease at the level above C4-5, compressing the exiting nerves. Adjacent segment degeneration are radiographic changes at the levels next to a fusion. In contrast, adjacent segment disease is a development of new symptoms due to arthritis above or below the fusion. The documented 10-year incidence of cervical adjacent segment disease is 25.6%. There's an annual incidence of necessary additional surgery up to 4% a year. The literature describes increased difficulty obtaining fusion adjacent to a prior fusion. His first procedure was an anterior cervical fusion at the level above the prior operation. This required him having clearance from an ENT specialist regarding his vocal cord function. This was followed by a delayed staged posterior surgery to provide posterior and anterior fixation to increase the success of fusion in this complex revision case. I hope you found this educational video informative. If you have additional questions or would like additional information, please contact my office.